Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today, we'll be discussing regenerative medicine with Dr. Jeffrey Gross. Dr. Gross is a trained neurosurgeon who spent years performing spinal and nerve surgeries, and he's now focused on regenerative and anti-aging medicine. His clinic is called Recalibrate, and he has offices both in Henderson, Nevada, and in Orange County, California. Dr. Gross, thank you so much for joining us.
Thank you for having me. It's nice to meet you and your audience. Hello.
So how did you find your way from spine surgery to regenerative and anti-aging medicine?
Yeah, it's a frequent and favorite question, and I love to tell the story. So thank you for that. I'm sort of a recovering neurosurgeon of sorts. I had treated patients with spine problems for over 25 years. And, nothing really had changed drastically in my career. We had the same things to offer people. Generally speaking, we had injections and therapies and anti-inflammatories, and that didn't always cure everybody. And then the last thing on our list was surgery. And, not everybody wants surgery, and not everyone fully benefits from surgery, and not everyone's ready for surgery. So there was this large gap in between, we'll call it non-surgical and surgical treatments. So patients would come and say, Doc, I know nothing else has worked, but I'm just not ready for surgery. And I'd say, okay, yeah, you're right, you're not. And they'd say, well, what else can we do? Because I also still have some of this pain and stuff. And I said, we can keep doing some therapy. We could do this, we could do that. And they would say to me, how about this? How about that? How about stem cells? And they just said it enough times that I finally listened and went back and retrained and stopped going to the same old spine meetings, although I go because I have to for my continuing education. But there's not a whole lot we learn that's new, right? We're doing the same old surgeries that we were trained to do 25 years ago, and the people that trained us had trained to do 25 years before that. So honestly, for 5 decades, we're really doing two kinds of surgeries. We're either making more room in the spine, called a decompression, or refusing two parts of the spine, which is this kind of big deal, right? We're locking together moving parts.
Right.
And don't get me wrong, in some cases, these things are absolutely necessary, but...
and there are attempts to come out with artificial discs. I don't know how successful they've been, maybe more successful in the cervical than the lumbar, but...
Agree, 100% agreed. But these they fall in the heading of the kind of things we've been doing for years. And outside of a couple little attempts to do different things, the vast majority of spine surgery is similar, generally speaking. So I finally went back and said, there's got to be something better. And I want to do my part to contribute to that. And that's why I went to different meetings and I retrained and I read and I studied and I still do. And I think regenerative medicine is one of those areas that is got amazing potential and results, mostly from other countries, but initially, but great results so far.
So why don't we start by defining some of the terms? What is regenerative medicine? What are stem cells? What are exosomes? What is placental matrix? What is PRP?
A great place to start. So the field of using your own biology, your own body to tap into its ability to help heal itself, fix itself, using your own cells' activities is regenerative medicine. And it's got the word regenerate right in there. And this comes from our own ability to regenerate some of our own parts of our body all the time. We're continuously making new skin cells and hair and nails. Our liver has a large potential to regenerate. But some parts of our body with age just don't do as well. Other species do great at this. You look like cutting off a lizard's tail or starfish can regain a limb. How come we can't do that? Well, we're learning more about those genes and those proteins and the things to re-stimulate the way you and I, Doc, used to heal when we were kids and we scraped our knee. And a few days later, that scab was almost healed. Whereas adults, if we scrape ourselves, it takes 2 weeks to heal it. Why don't we heal? It's the same body, same genes, right? And so regenerative medicine is using that ability to tap back into that. The very basis of regenerative medicine comes from cells that can divide into different types of organs or tissues. So when we're an embryo and we're a ball of cells, but all of a sudden we have organs and limbs and bones and things like that, those cells have decided to pick a job in our body. And before they pick a job, they're called stem cells because all cells stem from them. And once they pick a job, then they're called differentiated cells. And stem cells have this wonderful ability to be coaxed into any kind of job. But once they're coaxed, they're done. Right? It's like, hey, come on over here. We need more engineers, or we need people, working as nurses or whatever. It's sort of a job placement service. And those are what stem cells do. And stem cells are very robust in an embryo. They're very populous in a newborn and in the birth products related to a newborn, like a placenta, amniotic fluid, umbilical cord. These are rich with stem cells. And the placenta also makes lots of supportive proteins called the matrix, placental matrix. And then to the final definition, and thank you for letting me sort of run away here with this regenerative 101, is exosomes. And what it turns out is stem cells are, all cells for that matter, are making signaling particles to talk to neighboring cells, to tell them what's going on in the neighborhood. Hey, we got infected. You guys are at risk. So we're giving you a message to fight, make proteins to call for white blood cells. These are called cytokines. So there's a cell-to-cell communication within our body all the time. And these small cell-to-cell particles are about 1/1000th the size of a cell. They're often referred to as nanoparticles. And they have a little membrane, and they're chock full of growth factors, protein, signaling molecules, and microRNAs. And if you take those messages from youthful stem cells, or what we call stem cell-derived exosomes, because exosomes are the name for these little particles, you can give that youthful regenerative signal that a newborn has to an old guy like me. And that is one of the basis of the therapeutic side of regenerative medicine today.
I've heard you talk about exosomes, and I get the impression that you prefer exosomes to stem cells, or to use them both. Or in one of the interviews, I heard you mention that you use exosomes to activate the stem cells.
Right. So I'll work backwards from that. Activation means if we take these perinatal, youthful, amniotic sourced stem cell-derived exosomes, which are really a concentration of amniotic fluid and umbilical cord products, we can give that stem cell signal to someone. There are preferences I have for exosomes. I'm not advocating that they are necessarily better than stem cells, because stem cells deliver exosomes also. So an observation is that if you were to have a stem cell delivery to you, whether it's IV or in a joint or something, those stem cells are not going to last but 10 to 14 days. Then they'll die off like any cell. But in those 10 to 14 days, each one of those is giving off thousands of exosomes, sharing their signal with your own cells and your own stem cells. And that's the activation. They're giving a signal to your cells to behave like it used to when it was much younger. Exosomes also are much smaller, as I noted. They travel further in the body. They can cross the blood-brain barrier, where stem cells are largely too big. We can give a more concentrated dose, and they're about half the price of stem cells. Now, to be completely an objective scientist here, there's really no head-to-head clinical comparison of stem cells versus exosomes for the same type of issue. So we really don't have a complete answer. In our clinic, we've done both stem cells and exosomes. I personally have tried both. And frankly, the results are largely the same in my own experience.
So I think of probiotics as something maybe in some way to compare, because probiotics, and a lot of people think of them as something that's going to repopulate our microbiome. But in fact, the probiotics, at least the ones we have today, for the most part, they're just temporary visitors. But they do improve the health of the microbiome. And it's sounding like you're saying something similar about the stem cells, because I think a lot of people think that the stem cells now are going to go and create new cartilage cells in my knee and my shoulder or whatever. But you're saying they're only there for a short period of time and they're stimulating your own cells.
Correct. Your knee, anyone's knee, has the ability to generate more cartilage proteins and enhance.
Are there already stem cells in your knee before you inject the stem cells?
Absolutely. How else did you create that knee in the first place when you were in the womb, or even out of the womb? We're still developing our joints and our growth end plates. Some of the most active stem cells in our body are in our marrow of the bones. And as you know, those growth plates at the ends of bones have a high concentration of growth and development. It's almost like our life source is coming from these stem cells. So, and if you think about it, if I can go a little off track, some health delicacies include bone broth and bone marrow, if you go to some fancy restaurants, perhaps. Or if you were sick, in many cultures, your grandmother would make you chicken soup because it's from the bone stock of the chickens, rich in stem cells and exosomes. And you can actually ingest exosomes and they can be therapeutic. Cells get degraded when you eat them, but exosomes don't. And exosomes can withstand variations in temperature. They're almost like a biological signaling factor that can withstand the environment. So I think what we're doing here is we're tapping back into our own biology and trying to be more active in a more youthful sense by using a youth signal. And that youth signal comes from a youthful stem cell through those exosomes.
Now, what kind of stem cells are most effective? We have adult stem cells that can be harvested from the patient's own bone marrow or from fat. Or there's embryonic stem cells that can be gotten from a stem cell bank, I understand, right?
Right. So adult stem cells are generally less effective than I'll call a perinatal stem cell. Perinatal being around the time of a birth. And most of our sourced biologics come from FDA compliant labs that after a mother delivers her baby, donates her placenta and amniotic fluid and umbilical cord. And those labs process them, they test them, they screen them, and they supply to us what we ask for. And I don't know if you're calling those embryonic, because true embryonic stem cells are not yet clinically available here in the US.
Okay. So what do you call those cells?
I would call the ones we use that are around the time of birth perinatal.
Perinatal. Okay.
Around birth, perinatal. So embryonic, there's a whole science of reversing stem cells back into a even more potent state, where they have not only decided what job they want, but what kind of, development in the body they want to have. So those are called, embryonic stem cells, and they can be induced to go backwards along those pathways. And we don't have a full harness of their activity, but there's amazing potential and a lot of research going on. They're just not available in the US.
Now, what's the key to making stem cells maximally effective? I've heard some discussion that you need a very large number of them, And one doctor explained to me that's the reason, say, for going to another country like Panama, is that they can take the stem cells out of your body and then grow them to some larger number, which is going to be more effective. Or what do you think are the keys to getting a maximal benefit from using stem cells?
The different factors that go into that are, first, the recipient has to be optimized. So if we take someone who is eating poorly, who has hard living, ingesting a lot of alcohol and tobacco, and living in a bad environment and eating fast food, not taking the right supplements, that person is not going to have a good result. Number two is there is both a sense of quantity and quality of the biologic or the stem cell. So you're right. We have seen more benefit with increasing doses to a point. And you're more likely to get the higher dose stem cells out of the country than you will in, because I think I and my colleagues here are more conservative. Plus, I'm not a huge fan. Not that they're bad, and there's excellent research to show there are beneficial effects. I'm not a huge fan of adult stem cells because I'm 57, Doc, and my stem cells have been exposed to McDonald's over the years, and maybe a few too many adult beverages at a football game, and all the bad environmental things in the water and in the air, and not taking care of my microbiome until I figured out that was important, and all kinds of things. So my stem cells have been exposed to that degradation. And on top of that, I'm not a huge fan of fat source stem cells. Fat tissue has inflammatory markers. I don't want to deliver cells that have an inflammatory signal. I want the opposite. So I'm a much bigger fan of the off-the-shelf perinatal stuff because it's unadulterated, it's youthful, it's the best signal you can get. When you take your car to get the oil change, you don't put the old oil back in it. Now, this isn't meant to be in any way some type of insult to those who are using adult-based stem cells, because there are great results. It still works. I just want the young stuff. I want to give my clients the young stuff. So when you go out of the country, though, they do expand your cells. That's one method. In a petri dish, they take some cells and they divide. But cells can only divide so many times, and their telomeres become frayed, and then they become less potent. They're giving off a less potent signal. So just to get the number up could degrade them. So because we just don't have enough knowledge in that area, I say you just go with the pure stuff, unadulterated, undivided. Don't mess around.
Is there a benefit to doing stem cells IV?
There are many potential benefits. And of course,
what are some of the benefits to doing intravenous stem cells?
So the biggest benefit is that these provide a general anti-inflammatory signaling to your cells to switch the pathways from defense mode to improved operations mode. And when you do that, you are slowing down degradation of your tissues and focusing on regeneration of tissues. If you think about it, the word regeneration is opposite of degeneration. So cells it's like metabolism. You're either storing or you're burning. You're in one mode or the other. There's very little in between. So we're trying to flip our body signals into regeneration away from degeneration. So that anti-inflammatory signal is the best thing. So any problem you have that has an inflammatory component is likely to see some benefits or help with some benefits. So rheumatoid arthritis people tend to have help with their pain. People with autoimmune thyroid problems tend to have help with the effects. I've seen people with skin issues have benefits. We've had people with kidney problems, inflammatory change of the pancreas associated with diabetes to have improvements in those areas. And the low-hanging fruit are people who are responding to a disease process that need help with that, recovering from heart attack that has inflammatory changes, or Alzheimer's, which has an inflammatory response to beta amyloid proteins, or recovering from stroke, we've seen help. And I'm saying this very specifically as to help because the FDA has not approved any claims that we are allowed to say treat or cure.
Are there any risks with stem cells? For example, is there a possibility that since they stimulate growth, that they could stimulate cancer growth?
So that's been a question for decades, but it has yet to be demonstrated with the perinatal source exosomes or stem cells. However, with the embryonic tissues, there have been some reports in labs and in animal models, and that's why you have to be very careful with those. Having said that, any client coming to us who's looking for a regenerative option, who has a history of some ongoing cancer, I don't feel comfortable treating them because we just don't know. And I don't want to be the reason that possibly that cancer would grow worse.
When is it more appropriate, say, to use PRP versus stem cells? Some doctors combine them. I've talked to doctors who combine them with as well as with peptides and even ozone.
Yeah, so I'm a fan of all these things. PRP is sort of the lowest level of regenerative medicine.
Okay.
From your own blood. But again, I'm a fan of, you don't put the old oil back in the car. So there's nothing wrong with PRP in the right setting. It works, especially for, tendon and ligament injuries, things like that. It's used for many other things, cosmetic and hair, thinning hair, things like that. We can do the same thing with exosomes. Usually with PRP, you have to go for 2 or 3 sessions. And when you combine the cost of those sessions, it's almost similar to a single exosome treatment. So you might as well do it once instead of 3 times. Having said that, it's very interesting now that health insurance will cover, some health insurance will cover PRP treatments where it is just as unapproved by the FDA as all the other regenerative medicine treatments. So they tend to pick and choose what they pay for.
Yeah, I'm kind of surprised. I wouldn't expect that your insurance is going to cover PRP, but maybe.
They're starting to, yeah. It's cheaper than surgery, so they figured out if they can keep people out of surgery, it makes economic sense.
So let's talk about regenerative therapies to help with spinal problems like herniated discs. And I recently read Mark Hyman's book, Young Forever, and he discussed how he was having a lot of problems after having surgery for herniated disc, and he was having a tough time. I don't think the surgery went that well. He was having trouble walking. He had maybe he had a lot of pain. He had maybe some scar tissue or something, and he had injections of exosomes, and apparently he also had placental matrix, ozone, peptides, and it made him completely pain-free afterwards.
Right. So he had a lot of different things. So we can't point to one and say, okay, that did
right.
it. And that's fine. And listen, you've treated plenty of spines in your career. I've treated plenty of spines in my
thousands
career.
And thousands and thousands.
Herniated disc is, and we can define that for maybe some of the audience who doesn't fully understand that phrase, is part of the center of the disc, the gelatinous nucleus tissue has come through tears in the outer tough fibrous annulus rings and is out of place. And in some cases, it's fully beyond the ligament and it's extruded. In some cases, it's partially contained or protruded. And I do not yet have a regenerative medicine solution to push it back in. Okay. Right. So you still need to have the proper therapies, decompressive mechanical treatments, taking the weight off the spine, the right exercise and rehabilitation of your supporting muscles and ligaments and joints and everything. You have to do the work. And getting over the acute inflammation and all that's fine. Now, what we're not talking about when we talk about disc herniation is when that is out of place, that material, there's a degeneration that begins.
Right.
And many people don't understand that this is
degenerative disc disease. So
I was just going to, you
like this,
stole my thunder.
Like sorry.
I was going to actually be down on that phrase. The phrase is it's not a disease. It's a subsequent degeneration. It's not a disease you can catch by someone coughing on you. It's not a disease you can get because you were born with it, although there may be some genetic factors that could predispose you. It is a degeneration related to trauma, even if it's not acute trauma. It can be accumulated wear and tear on a disc. It's not a disease per se, even though I want to take we out of that. Many people refer to this as degenerative disc disease or DDD. And what it is, it's a wearing down of the cushioning property of the disc. And I know you know this, Doc, but for the audience, and over time, the disc is not as functional as a cushion, and we start to feel pain. And the pain could be from the bone above and below. It can be in the joints. It can be in the surrounding nerve structures and other structures. It's very complex, and that's why it's hard to fix, and it takes a lot of people. So there are many things that have been tried for that, but let's get down to basics. How do we restore that disc? And I'm not the first to invent this. This comes from great work with many years of follow-up in Europe. And of course, they were ahead of us in this, where they have found that because a disc gets its nutrients from the surrounding end plates, it gets its blood supply from the bone above and below. Because think about it, discs are biological rubber, not a lot of cells in there, mostly proteins. It loves to be hydrated, which is why you're a little taller in the morning when you get up out of bed than you are in the evening, and you've been pressing the water out of those discs all day. So to restore the function of the disc, you have to turn on the factory that made them in the first place, meaning the vertebral bones. And what's in those bones is bone marrow. And what's the main constituent of bone marrow but stem cells? So my own practice is to deliver the exosomes to the end plates of the bone above and below to restore the production of the cartilage proteins, the proteoglycans and chondrosoglycans that make that disc what it is, that squishy, bouncy cushion. And we have wonderful results with before and after MRIs. This is extrapolating from a lot of the knees we're doing and the knee literature, and we do it in other joints too, hips and shoulders. But the spine really is where the magic happens.
So do you think most of the doctors out there who are doing stem cells are injecting it into the end plates or injecting it directly into the disc?
Most of the doctors in the US are injecting into the disc.
Okay, that's what I thought.
I'm probably the outlier.
And that could be one reason why they're not getting as good a result.
There are some good results. But if you look at the knee literature from Dr. Herneglau in France, they have over 15-year follow-up, and they segregated the patients. They had a group where they injected the bone end plate above and below the meniscus,
right,
and a group where they injected the meniscus. And it's crystal clear based on the results that the bone injected group did significantly better and for longer years than the joint injected group.
Can this also heal a torn annulus in a disc, or torn fibers in a disc? Yeah, annular tear. Yeah,
through that process of growing new proteins and regenerating that, it's probably our best candidate to repair a torn annulus. There really is no other technology that does that reasonably.
Okay. So what would you say is if somebody was thinking about somebody has a degenerative disc, told they need spinal fusion surgery, and they're considering getting stem cells. And what would you say is the likelihood that one treatment with stem cells is likely to make them pain-free or mostly pain-free and be able to avoid fusion surgery? And also,
I don't have enough.
Okay, you don't have enough data. Is it likely to create stability, which is what they're looking for as well?
Well, an enhanced annulus and surrounding ligaments can add to stability, but they got to do the work. A lot of patients with significantly degenerated disc are in too much pain to do the type of rehabilitation we're talking about, the type of building of the muscles of the back and the core and the sides and everything. So I think that someone like that, looking at the long-term results, outcome results from fusion, would be quite smart to try one approach or one delivery of regenerative medicine, whether it's exosomes or stem cells, to the surrounding bone, and give it 6 months. And if they notice some improvement, then they can stay on that wave. And if that improvement plateaus, they might do a second one. Now, I've never done a second one in anyone, but of course, there's going to be someone bad enough who needs a second one. I just haven't seen that person yet. And if we can help avoid that fusion surgery and help add to stability, and the spine's mobile, stability is relative. It's not completely stable. It's stable enough.
Right.
So that's all we need to get is stable enough.
And
I think there's potential for this. Yeah.
Yeah, there's a significant percentage of patients who do get, say, microdiscectomy. They have a herniated disc. The piece of the disc is removed. And let's say the leg pain is gone, but they're still getting these continuing bouts of back pain. It sounds like that might be a good time to consider getting stem cells to create more stability and regenerate that disc to some extent.
Ideally, yes, because like you said, the herniation is removed. We don't have to deal with that. There's likely no longer any nerve involvement once you take away the offending herniation of the disc. And what you have then is an accelerated degenerated disc. And you need to try everything you can to give that new life.
And is there a benefit to a patient who's getting regenerative care like stem cells to also take supplemental collagen, glucosamine, and chondroitin, vitamin C, some of the other things that can help with healing of connective tissue and regeneration?
Yes, you see me nodding vehemently because we want our patients to optimize before we do this, because if they're going to spend the money on a regenerative procedure, we want them to get the most out of it. So we make sure they're on adequate nutrition, protein, supplementation, and even in some cases, peptides. There are many peptides that contribute to healing of myofascial structures, BPC 157, others as well. Which
others do you like?
We've used some of the bioregulators, you caught me off guard. I have a whole list of the Wolverine protocol that I give people, but
the Wolverine protocol.
If
did you go to Michigan?
I'll tell you what. After I didn't Wolverine, as in the comic book Wolverine, not the Michigan.
Okay.
but no. I'm from Ohio. We don't even use the M word around my house. But after the podcast, I'll send you a list of those peptides. You can put them in the show notes if that's okay.
Okay, sounds good. So let's talk about regenerative therapies for knees, hips, shoulders. Can we actually help people to avoid joint replacements?
We absolutely can help them.
You know what? Can you stop a second? You kind of faded out.
Treating the bone.
Doc, can you stop for 1 second? Can you start over in answering that question? Because it was fading in and out. I think your connection got a little.
I'm on a wireless.
Yeah, I know. Sometimes it gets squirrely. If you could start again with the answer to, can we save people from joint replacements?
We can help those people. We can't help all of them, but we have results, particularly in the knees. Knees are very, very common in my practice now, even though I'm a trained spine doc. And the knees come from the French literature. We're doing exactly as they prescribe. And our results are at least as good as theirs. And we have MRIs before and after in some cases where we have shown resurrection of the thickness of the cartilage in the knee. So we know we can do this, and it's exciting to see.
Okay, that sounds great. What about for tendon, ligament injuries? What about rotator cuff tears?
Yeah, we've done those as well. Anything you can do with PRP, you could probably do at an enhanced level with something more powerful in the regenerative family, exosomes, stem cells, these kinds of things.
I don't know if you've seen, but there's a study that came out. It was either earlier this year or last year, and it showed that patients who tore their ACL, that instead of being braced in a brace that kept their knees straight, they had a brace where their knee was in 90 degrees of flexion, that there was a much higher likelihood that the ACL could actually heal without needing surgery. I'm wondering if an athlete was in that situation, would taking stem cells at the same time make sense?
It probably would enhance that healing process. There are some physicians in Oregon I've seen deliver stem cells to the joint space after a tear like that. We have done it here as well with exosomes, where I've delivered to the bone and into the joint space. And I'm waiting for those results. We're waiting for some repeat MRIs here. We'll let you know.
What about patients who've had, like, I have a lot of patients they had a hip replacement or they had a knee replacement and they're still having a lot of pain. At that point, can stem cells possibly be of benefit?
Potentially, it depends on the reason for the pain. If the pain relates to the interface between the bone and the implant, they might benefit from a better, what we call osseointegration, meaning the bone in the implant are a little bit wiggly, and that's causing the pain, just like having your braces tightened when you were a kid.
A lot of the patients that I'm seeing, like I probably have 5-6 patients now who've had hip replacement, and they're getting various sorts of pains, and it's not clear why.
Yeah, I mean, listen, we're changing the mechanics when we do a fusion or replace a joint. So we've got to have a good understanding of why there's pain, and there are things we can do to address them, including regenerative medicine to help the bone grow. A lot of these patients are osteopenic or osteoporotic to begin with, right? They're usually in middle age or beyond, and they don't have great metabolism. They're losing bone mass, and that bone mass is the source of their marrow and their stem cells. So they're not going to heal well. So we need to enhance their bone density and their stem cell activity. And one way to do that is to help them with an IV of exosomes.
Okay. Can it help with osteoporosis?
We have seen that significantly, yes.
Interesting. What about stem cells for organ regeneration? What about for neurological conditions like Alzheimer's, congestive heart failure?
So there's wonderful literature. So this isn't just Jeff here saying you can do this, but to help with cardiac rehabilitation, because there's an inflammatory component in responding to myocardial infarction or heart attack, that IV regenerative stem cells or exosomes can be helpful in that. There was a study earlier this year about heart failure and the use of regenerative medicine, IV. We see the same with recovering from stroke. We've seen patients receive some help from IV. We also sometimes do intranasal because there's a good delivery to the brain when we just drip some the exosomes in the back of the nose. There's a whole group of people who address autism through this mechanism and have seen help with benefits there.
So have you seen benefits for patients with dementia, Alzheimer's?
Yes, we have. There aren't many that have come in because by the time they've exhausted all options, it's probably too little too late.
Right. Now, Dr. Dale Bredesen has pioneered a functional medicine approach that we've been employing in the office, and a number of other functional medicine oriented doctors are starting to employ. And it sounds like stem cells properly utilized in the context of a full functional medicine approach, addressing diet, exercise, and looking at all the other factors that affect the brain health might be of great benefit. Do you think in that case an intranasal perfusion might make the most sense?
I think that would be the easiest delivery, especially if you're catching someone and doing a multidisciplinary program, catching them early, or even now they have new risk factor tests that you can catch people even before there's a symptom. And ideally, I can imagine a couple of years from now, everyone's going to have a screening test in their 50s for dementia, and then they might join a program like yours, and that would be ideal. Because I think if you ask me what's the number one thing you could do to prevent dementia, I would say exercise. I'd say promote your organs of longevity, your muscles, and therefore your bones. And again, you promote your bones, you promote your marrow, you promote your stem cell activity.
Right. Now, what about the legal status of stem cells? I know that the FDA has been threatening to ban the use of stem cells. And I did a bit of reading on it, and I see where the FDA doesn't get to regulate what doctors do.
Correct.
But they've been trying to claim that stem cells are medicines, and that they have to go through FDA review. And I saw that there was an 11th Circuit ruling that went against a stem cell center, and then there was a federal judge in California that ruled in favor of the stem cell treatment center, saying that the stem cells, which are not drugs and therefore don't require pre-market review.
All of that's correct. The FDA regulates what claims can be made about a supplement, drug, product, food, or implant or device. They have planted their flag of jurisdiction in biologics. So that's why I'm compliant here when I say I'm not making any claims that I can cure or treat anything. Even though as a doctor, I really have never guaranteed anything, So I'm sure you have the same, right?
Yeah, obviously.
Yeah. So I don't want to violate that in any way.
I understand. I'm not trying to get into a gray area with you.
No, not at all. But so I won't make claims. All our paperwork and my explanations are thorough.
Right.
I don't make claims. Now, that doesn't mean people aren't smart and can do their own homework, and there's great literature I can draw. There's nothing I'm doing that's for fun. This is all based in good medical literature and science, even if that literature comes from France or Germany or Russia or China, because they've been able to do more. So we don't make those claims, and we try to use these things to help people heal, and
right.
that's okay. So you're absolutely correct about that case. The appellate court did overrule the lower court, and I think that may be being pushed up towards the Supreme Court. I don't know if the Supreme Court.
I think right now there's an appeal at the 9th Circuit. The FDA, Department of Justice, is appealing the federal judge in California who ruled in favor of stem cells. They're appealing that to the Ninth Circuit. And then after that decision comes out, we'll see if that ends up going to the Supreme Court. It probably is a probably reasonable chance it may eventually make its way there.
Right.
So get your stem cells now. But hopefully there'll be enough positive research coming out about the safety and effectiveness of stem cells by the time that ruling comes out. Because I know there's a bunch of studies currently underway right now with stem cells.
Well, you listen, there are new studies coming only because the larger pharma companies are now investing in it and putting their hands in it. So that's what's happening. Studies have been largely unfunded here for many years. There was a big push in the 80s, thanks to the work of Christopher Reeves, after what he had gone through and his foundation. But things fizzled after that. And you don't have to leave the country to have quality regenerative medicine. You can. You want to make a trip out of it. There's some wonderful places to travel, but you don't have to.
Right. And your clinic is in Nevada, and then you also have a satellite office in Orange County. That's correct?
Right. Most of my regenerative activities are now based in my Henderson, Nevada office. Most of our consultations are done remotely, through the magic of Zoom like this. And then, we help people do all the right tests, get the right studies, evaluate them. I don't want to offer this to anyone I don't think we could help.
Right. Absolutely. So what's your website? How can listeners find out about getting in contact with you?
Thank you so much. Well, our business is called Recelebrate because we are reinvigorating your cells. You should celebrate that. And that's spelled ReCellEbrate. And you can find us on Instagram at Recelebrate, LinkedIn, Facebook. Our website is recelebrate.com. Just type in Recelebrate, you'll find us.
Great. And so you're able to do stem cells. Mostly you're focused on musculoskeletal conditions?
I'm not specifically focused on that. That's why I got into the business,
right.
Being a spine doc, but right. We do lots of different things now. We've done, we have some cosmetic stuff we do for thinning hair. For dry eye syndrome, we have an eyelid injection to stimulate the meibomian glands. We've done male and female sexual function shots called O or P shots.
What is that? And that's stem cells?
Well, we do exosomes, but
exosomes. Okay.
Yeah, so it's to improve sensitivity and function and in our genitalia.
Okay. What about organ failures like hearts, kidneys, things like that?
Yeah. So I even met with someone today who has a slowly rising creatinine, meaning the kidney function is decreasing and they're not able to clear out the creatinine. So we have had cases where we've done IV and improved the creatinine to keep people from needing dialysis. It's really trying to help your kidney regenerate or reduce inflammation. We have to help people with metabolic issues, diabetes, become somewhat improved with sugar management based upon the knowledge that there is inflammation in the pancreas around the...
Could the stem cells be injected into the pancreas to possibly rehabilitate beta cells? I don't know. And the reason I don't know is, going through a surgical residency, one of the rules of surgery is you don't touch the pancreas. You don't stick anything in the pancreas. It doesn't like to be touched. Right.
It's like having a rattlesnake inside your abdomen. You just don't mess with it. So, what we do IV.
Right. Okay.
Yeah, but it's a good question. Could you inject it sort of into the?
Well, I've sort of heard of putting back in. I think there's research. I don't think it's being done therapeutically yet, but trying to plant in the beta cells to recover the ability to produce insulin.
Yeah, it's a great area of research, and I hope there's a solution quickly for that, because it's such a big problem and a widespread problem. And if you can't manage your sugar, your inflammation is out of whack. And if your inflammation is out of whack, you're going to age faster.
But of course, 90% of the patients with diabetes, it's due to diet and lifestyle. So change your diet and lifestyle.
100%. I don't want to skip over the obvious, and you're 100% right. Just because we're talking about regenerative medicine doesn't mean this is a replacement for sleeping right, breathing right, eating right, exercising, and supplementing properly. 100%.
Great. Okay. Thank you so much, Doc. Any final thoughts you want to leave the listeners with?
No, I appreciate you. Yeah, great questions. If anyone has a question, I love to meet new people. Reach out, send us a message. Be happy to talk to you, have a quick conversation, whatever. And I appreciate the chance to be on your show. Thanks so much.
Thank you, Doc. Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would certainly appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. That way, more people will discover the Rational Wellness Podcast. And I wanted to let everybody know that I do have some openings for new patients, so I can see you for a functional medicine consultation for specific health issues like gut problems, autoimmune diseases, cardiometabolic conditions, or for an executive health screen, and to help you promote longevity and take a deeper dive into some of those factors that can lead to chronic diseases along the way. And that usually means we're going to do some more detailed lab work, stool testing, sometimes urine testing, and we're going to look at a lot more details to get a better picture of your overall health from a preventative functional medicine perspective. So if you're interested, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a new consultation for functional medicine. I'll talk to everybody next week.